This is Tom Getzky. It is truly my pleasure to introduce our next speaker. Dr. Melissa Mork is a professor and chair of the Department of Psychology, Criminal Justice, and Law Enforcement at the University of Northwestern in St. Paul. She is the author of the book Navigating Grief with Humor, and her highly anticipated next scholarly endeavor, Self-Care, a mildly interesting, reasonably priced, fairly practical guide to caring for you. Today, Dr. Mork will share something that we can all use in these challenging times, an understanding of self-care, how we can meet our own unique needs in ways that allow us to thrive. Please help me to give a warm AATH welcome to Dr. Melissa Mork.
Well, thank you, Tom. Sorry, everybody. Tom and I are both from Minnesota, so you now have an hour of listening to people who sound like Marge Gunderson from Fargo. Today I'm going to be talking about self-care, and the topic of burnout and self-care is actually the reason I am at AATH. In 2012, I was department chair of our department, as I am now. I was teaching full-time and I was applying for tenure at the university, but I was also seeing patients full-time at my part-time, at my clinic. I was president of a board for a college consortium. I was parenting 2 young children. I was active in their schools and in my church. And I was 105 pounds heavier than I am right now. And in the spring of that year, I had a heart attack. So I went to a training in the fall of 2012. I was also, along with all the other tasks and roles I was involved in, I was also part of the critical incident stress management team for the North Metro in the Twin Cities area. And on that Friday of this mandatory training, the trainer spent the entire morning addressing the topic of burnout and compassion fatigue. To start, he had us fill out this assessment, and one of the questions, my friends, was, when is the last time you laughed until you cried? I was stumped. I couldn't remember the last time I had laughed until I cried. I couldn't even remember the last time I had actually laughed, like legitimately belly laughed. I was confused, I was sad, I was frustrated, and for those of you who know me, you know how much I love laughing. I'm at my best self when I am laughing. And so I realized that from the final numbers of this assessment and from that one question, I realized I was in serious burnout and I needed to make some changes. As Tim Walsh mentioned this morning, the opposite of play is not work, it's depression. I wasn't playing, I wasn't laughing. I hadn't laughed in a really long time. So after that presentation, that training, I went home and I decided to make humor and laughter a priority again. And then I found AATH. I found my tribe. So when I talk about self-care, I am speaking from personal experience, from serious sense of personal failure in my own life where I was not taking care of myself. I was burned out. And as a result, I was resenting the people I was trying to serve. I resented them for asking me for more than what I could potentially give. And I wasn't able to give much, even to my kids. My emotional margin was so narrow. I was easily irritable. I was chronically annoyed. I was trying to pour from an empty cup. So when I present, I like to tell a lot of stories, but today I want the final story that is told to be about you. The whole reason I'm doing this presentation is because I want you to be able to tell your story of when you were burned out and how you recovered. So as I'm going through this presentation, I'm continually going to be asking you about what you are doing well and what is one thing that maybe you could change, one thing that could maybe nourish you or fill your cup or help you flourish or thrive. What is that one thing you can do each day to make yourself jealous and your future self grateful? How can you make your past self jealous and your future self grateful? I'm going to keep chat open. I'm going to be checking it every so often. And there will be times when I'll be asking you a question and I want you to participate in chat. So keep your fingers ready for a couple of moments of interaction. What I want to talk about first of all, though, is what isn't self-care. When we think self-care, we think mayonnaise and petties and dark chocolate and wine, and those are all nice things. Who doesn't want a nice massage? But think about this. When you offer to take care of somebody else's baby and they bring that baby to you, do you give it a mani-pedi? Do you give it red wine and dark chocolate? Well, no. Well, maybe a little brandy. No. What you do is you give it nourishing food and you give it affection and you give it a safe place to lay its head. You give it actual, true, nourishing care. So what is self-care? We're going to go through what I like this as a framework. I'm not married to Abraham Maslow's hierarchy of needs, but I think it gives us a nice framework to look at what are some basic human needs and where are we maybe not meeting our needs. And so I don't know if you can see my cursor, but I'm pointing at the bottom level here of physiological needs. So physiological needs are the most basic needs that we all have. And I'm going to go through a list because one of them you may be neglecting. But Maslow believed that we need to meet these physiological needs first before we can move on to meeting our safety needs. So for example, I might go out into a dangerous area, maybe there's gunfire or it's a war-torn area, but I will risk my safety in order to obtain food and clear water for my children. So we are going to meet our basic physiological needs first before we move on to safety needs and then belonging needs. And yes, sometimes people will sacrifice or violate their safety needs to stay in meeting their love and belonging needs. For example, they may actually stay in a violent relationship, which violates their safety needs, but they're staying in it as a way of meeting their physiological needs. They're staying in the relationship because there's financial security, perhaps. So I'm going to move through this list of hierarchy of needs and visit some specifics and ask you, what are you doing well? And what might you need to change? Keep in mind, perfectionism is not allowed. It is absolutely not allowed. Perfectionism is toxic. When you have these unrealistic goals that you're trying to meet and you keep setting them farther out. So let's say you reach your goal that you set for yourself and you think that's not enough. And then you set further ones out and out. You can never attain them fully. You can never be fully satisfied. That is not the goal here. I want to help you find a way to remove some difficulties from your life or add in some nourishing parts of your life that will help you flourish more. Yes, perfection is pure fiction. Brene Brown, she says it's a shield that covers our shame. And we're not drawn to people who are perfect. We actually find them slightly repellent. And so if you are striving to be perfect, you are actually pushing others away. It's in our failure that we are most appealing, don't you think? We like the people that are slightly flawed. I know I do. So physiological needs, first is hydration. If you're like me, coffee is my primary source of hydration, and I'm fine with that. Don't criticize me, back off. However, some of us, my daughter, if she doesn't have water in her hand at all times, she's parched. And so that is a need for her. We have different, yes, we all need water, of course, but some of us have different levels of attentive, intentional need. Elimination. Joy, go get a drink. Elimination. Okay, so when I do this presentation in face-to-face or on Zoom where I can see people's faces, some people look at me like puzzled. What is she? Why is she? People don't meet that need? No. Actually, I have a friend that does supervision at schools and she holds it all day. Like she drinks enough water. She just never takes time to go to the bathroom. And there have been times when she has gotten home after holding it all day and she puts the lock or the key into the lock of her front door and whoosh, she has ruined 2 pairs of shoes that way, my friends. So elimination is a need, and some of us just don't even take the time. Would you ever do that to your child? Prohibit them from using the restroom, forbidding them, telling them, yeah, she knows she's part of my example. I don't use her name, Wendy Richards. Another need is nutrition. Are you nourishing your body? When I was 105 pounds heavier, I would say I'll do anything to lose weight except diet and exercise. And guess what I had to do? Diet and exercise. These are needs. And listen, with exercise, if we could take all of the physical and emotional and psychological benefits that we get from aerobic exercise and encapsulate them into a little pill and put them in bottles and sell them on the shelf, those pills will be flying off the shelves, and yet we have access to this for free. So this might be an area that you may want to consider. And the question is, how do I motivate myself to do something that I don't really just naturally want to do? When I went to Grief Share after my husband died 3 years ago, I went to Grief Share, and one of the things they told us was to just do the next thing. Just the next thing. Don't try to do everything. Just do the next thing. So when it was time for me to lose weight, I didn't plan on losing 105 pounds. I planned, my first step was to put on my tennis shoes. And then once my shoes were on, I thought, well, I've got my shoes on, I might as well go walk on the treadmill. So I'd go, but I didn't set out to lose all of that weight or to exercise every day for the rest of my life. I just stepped into the next thing. And how do you write a book? You sit down at your computer, and then what? You open your computer. Just do the next thing. Don't try to tackle the whole thing. Sleep. Some of us have conditions, medical or psychological conditions, that preclude us from getting high quality, long sleep. But for some of us, we aren't getting enough sleep because we are on our screens too long, and we have overridden our drowsiness. We override our ability to perceive drowsiness, and then we're not getting enough sleep. And that might be the one thing you need, because when we are sleepy, when we are sleep deprived, we're cranky, we're irritable, we're hard to be around. We eat more, we exercise less, we are less productive, we show up for work but don't do as much as we would if we were well rested. So there's a lot of things that happen when we are sleep deprived. Hygiene. For some of us, our hygiene has kind of slipped because we're social distancing. Nobody can smell us. And that's the benefit of masks too. Nobody can smell your breath. It's one thing you cannot escape once you're wearing a mask though, right? I cannot get away from my breath. But hygiene, I do see with in the past with patients, when mental health starts to go down, so does their hygiene. And so there is some correlation there between hygiene and mental hygiene, mental wellness. And so maybe that's something you could address. Shelter. Shelter is not necessarily do you have shelter, but are you caring for your shelter? Are there light bulbs you just haven't gotten around to replacing? Or there are these things called, that I refer to as mosquitoes. Mosquitoes are those things that are just kind of buzzing in your ear. You're never getting around to doing them, but they just annoy you. So, walking into my pantry and the light is burned out, and every time I go in there, I'm like, oh, but I don't replace the light bulb. But if I did replace that light bulb, I would be swatting that mosquito and the buzzing would go away and I would be so relieved. So are you attending to your shelter needs by taking care of your environment? Some of us have strong nature needs, being outside, getting your hands dirty in the earth, being around animals. And if that is one of your needs and you've been denying yourself that, maybe that is the one thing you need to return to. After Scott died, somebody gave me this book. You probably can't see it. It's the little book of Hygge, the Danish Guide to Comfort. And the Norwegians call it koselich. We call it cozy. But what it is this intentional cultivating of your environment towards comfort. I did my doctoral dissertation for the Department of Corrections for the state of North Dakota, and I did interviews of repeat offenders about criminogenic thinking. And I would go into the prison and meet them there, and I realized that the one thing we take away from them, along with their freedom, is we take away their comfort. There's no soft seating. There's no place to rest. There's no place, like if they're watching TV, they're on plastic stools without backs. If they're at the cafeteria, they're sitting on plastic stools without backs. The only place that they find comfort is on their little thin mattresses in their cells. Comfort, we remove comfort as a punishment for those who are incarcerated. So when my kids would come home after Scott died, I made a purposeful decision to have something baking in the oven that smelled good. So they would walk into the house and they would smell brownies or casserole or bread or cookies. I had soft blankets draped across the back of every chair so we would have something warm to cover us up. I had candles burning, well, flameless candles. I would have the electric fireplaces going just so that it was comforting in our home. Soft music, not a lot of loud noises. Some of us have a need for comfort. Maybe you do, and you're not giving yourself that. Pain relief. Pain relief, not just taking Tylenol when you have a headache, but is there a condition that's going on in you physically that you're not taking care of? I had a congenital hip issue and I just suffered through it. I was using a cane continually for a while, and I was starting to eye other people's wheelchairs thinking, boy, that looks comfortable. And I realized it was time to have hip replacement surgery. So I did, and it is the best gift I gave myself. So check your body and see if there's something that is just causing you pain that maybe you could correct. Some of us have a deep need for physical touch. A number of us are huggers, and we have been denied meeting that need for far too long. It'll happen again, my friends. It will happen that you will be able to touch again. We also have a need for sexual release, some of us more than others. And if you've been denying yourself that, find ways to maybe meet that need. And then laughter, humor, mirth, and play. Hang on a second, we're going to get to that. But first, I just want to ask you this question in reflection. Which need might you be neglecting on this slide? So in chat, I'm seeing you're pretty active there. I love that. I'm watching the scrolling, but in 1 minute in chat, and I've got the timer going, I want you to write down, how does humor, laughter, or play meet a physical need? Not social, not emotional, not psychological, but how does it meet a physical need? Now, we've got certified humor professionals here. We've got people who present. We've got people who've studied this. It releases tension, pain control. It changes your mood. It works on your abs, yes, lowers blood pressure. It's exercise, it's internal jogging, right? Physical, what are some physical? Yep, it helps you breathe. It exercises your pelvic muscles. Yep. Helps with your digestion. Yes, it is a physical release of tension. Yes. It moves energy that's stuck. Relaxation, immunity. Yep. Good. Decreases inflammation. It helps you reach the Oreos. It oxygenates your blood. Yes. Excellent. See, this is why I rely on you guys. You're my tribe. Look at that. So in summary, it enhances intake of oxygen-rich air. It activates your stress response. So it fires up your stress response and then cools it down. Like you're tensing up when you're laughing and then you feel that release. It soothes tension, it releases serotonin, it increases dopamine and kicks up endorphins. So you've got this cascade of feel-good hormones and neurotransmitters. It activates the reward centers in your brain. It improves immune function. It relieves pain and it reduces the risk of cardiovascular issues. And that is just scratching the surface, my friends, of what laughter can do for us. It helps us pass gas. Thanks, James. All right, so we're going to talk about safety now, and I want you guys to tune in because we've had some threats. We've had threats of external dangers, right? Some of us are in homes where we're not feeling safe because of physical, verbal, or psychological threat. And if that is the case for you, please reach out to me and I can help you locate a safe shelter or a way of finding and locating safety. When my husband died, I realized, they say you can't take it with you, but apparently the one thing you can take with you is the passwords. But we are facing digital risks all the time, identity theft and other risks. And so those are external dangers. We also have community or international violence. Tom and I and a number of others on the call right now are from Minnesota. And last June, we watched as our city burned after the murder of George Floyd. And it felt quite unsafe for me alone here with my children. So there was a sense of real threat in our community. And then, of course, we're all on Zoom and not together because of a threat of a virus. And so those are external threats. But what I really want to talk about is our internal threats. I've already talked about perfectionism. Perfectionism is, like I said, it is a toxic state of being. And if I could remove one word from our vocabulary, my friends, it's the word must. I must do well. I must be successful. I must be well liked, or you must treat me well. You must recognize my importance, or life must be fair, easy, hassle-free. These musts are so demanding. And so, yep, masturbation. Thank you, Penny. So what I would rather we use is the word prefer. I prefer to do well. I prefer to be successful. I prefer that you treat me well. I prefer that you respect me. I prefer life be stress-free. But what happens is that it releases those demands, those musts. We let go of those with our preferences, and we can hold things a little more loosely in our hands. And so if we use the word prefer, I prefer to be well liked. Boy, wouldn't that be nice? But if I'm not, I'll be fine. Whereas if I'm saying I must be well liked, suddenly I'm putting a lot more pressure on myself and everyone else. It is much better to say I prefer. Another threat to internal safety is financial worry. And it's an easy platitude for me to say, just take control of your finances. However, if there is a way that you can get help for creating a budget and tackling some of your debt, or doing something that will get you a little more control over your finances, everything else in your life will feel easier. Because when I talked about mosquitoes, that one thing that is just constantly buzzing in your ear and you can't seem to escape it, if it's financial worry, that is a particularly heavy burden. So if you can address that before anything else, I would strongly recommend that. Negative self-talk. What's the language you use when you talk about yourself? Are you saying, what are the words that you use? Are you saying things like, I'm a joke, I'm disgusting, I'm worthless? Are you using words like only, never, always, can't? If we can tap into the language that we are using in our internal dialogue, we can remove an internal threat, because we are treating ourselves very badly. You're saying things to yourself you would never say to another person. Hopefully, you would never say that to another person, but you also would be wise not to say that to yourself. External locus of evaluation, what is that? How do you compare yourself, and to whom or to what do you compare yourself? So if I compare myself externally, I might compare myself to Tabitha's sense of humor, or Colleen's sense of humor. I compare myself to how cute Mallory is, or I compare myself to how funny Beth Slazak is. If I'm comparing myself to other people, I will never measure up. Never measure up, because I'm seeing their highlight reels and I'm living my own behind the scenes footage, and it's an absolutely unfair comparison. So I encourage you to shift your focus to an internal locus of comparison. Oh, I'm sorry, if I compared myself to how handsome Sporty is, I would never measure up. So if I measure myself to who I was yesterday, or last week, or a month ago, or in 2012, it's a much more fair comparison. It's a much more realistic and balanced comparison. So an internal locus of evaluation is comparing. No, Mary Kay, don't compare yourself to me. I certainly can't compare myself to you, you energy. You're like that energizer bunny. So that external locus of evaluation shifts to internal. And I want to talk about a maladaptive stress response cycle. What are some unhealthy coping strategies? An unhealthy coping strategy is something that either gets you stuck or pulls you further away from your goal. Oh. I like this one. We binge on shopping, we binge on food, we binge on screens or alcohol. And there are other ones too. I've got a number of students that engage in self-inflicted violence, have other addictions. And so this maladaptive stress response cycle it's a coping strategy that you might engage in that you usually only do when you're alone in private and nobody can see you. So it might be eating or drinking or shopping or something else. And so what happens is you've got stressors building all day long, right? You haven't been taking care of yourself. Stresses are building. People are bugging you. You've got a lot to do, not enough time. And by the end of the day, you are exhausted, you are depleted, you are burned out, and the opportunity arises to engage in one of these behaviors. You lock the door, you shut off the lights, or you put the kids to bed, and you engage in some sort of routine. And depending on what it is that you're doing as your maladaptive coping strategy, that routine might be opening up your laptop. And usually it's happening while you're dissociating. You're not even really in touch with who you are. You kind of lost your sense of self, and not in a good way. You're so lost in thought, and you're numb from your emotions. And so you're engaging in this routine, and then you engage in the event. So in the example, for example, when I was heavier, I was engaging in a lot of binge eating. So I would put the kids to bed, I would turn out the lights, and then there would be this gravitational pull to the kitchen where I would get out all of these snacks and I would sit down and I would just binge on food. So that routine would be walking into the kitchen, and the event would be the actual binge. After the binge, I would engage in self-care by actually cleaning up the wrappers, hiding the chips bag. But that self-care was false self-care. I was just cleaning up. I wasn't actually taking care of myself. For clients who have been cutting, for example, they'll engage in that opportunity, dissociate, pull out what they're going to use to cut. They'll engage in the event, and then they'll bandage the wounds. That self-care, as I said, is false self-care, however, and very quickly shifts to shame, disgust, self-loathing, embarrassment. You're mad at yourself. You did it again. You didn't want to do it again, and you did it anyway. And that predisposes you to a vulnerability and to engage in that opportunity again. And so it becomes a vicious cycle of over and over and over again. I guess my question to you is, how are you coping with those internal threats? Are you creating more of them through these kinds of behaviors? Shopping with money you don't really have, or eating money that doesn't nourish you, or drinking to escape the feelings that you're having. I've talked about safety. I want you in chat to highlight how humor can enhance our safety. How can humor help us feel more safe, externally or internally? This is a bit more of a challenge than the physical ones. Be forgiving of yourself. It builds trust with others. It diverts nonsense. It gives us control, a lightness. Erases fear, gives us a break, makes it more relatable. We can laugh at the absurdity. Yes, it changes our perspective. Self-deprecating humor, it levels that playing field and makes us more approachable to others, makes us feel more safe, builds relationships, helps us let go. These are great answers, and it's so great to see these names. It reframes the news. This is why I love memes, why I love TikTok, why I love YouTube videos, is that reframes the news and it feels less threatening. I need to manage how much I consume of the news, because it can feel so heavy and burdensome. But if I can laugh at the news, at some of the ridiculousness of it, it doesn't feel nearly as threatening. Good. So some of the safety benefits I thought of just off the top of my head: only the clown was welcome in other villages. So from the beginning of time, I think humor was a way of communicating safety. And then Tim Walsh this morning talked about the safety to fail. I love that concept that if we can laugh at ourselves, we present the safety for others to also make mistakes. So that self-deprecating humor, it helps level the playing field if you're a leader or an instructor or a parent. And there's the authority and then there's the submissive. Well, sometimes with humor, we can level the playing field. It reduces tension in relationships. It changes our perspective. Some of you have seen that the hand, here, all you can see is just, the problem. But if you can laugh about it, suddenly you have clarity and dimension and peripheral vision and objectivity and all those other things. And it helps us mediate conflict. There's so much, like any one of these could be an entire presentation, right? But humor definitely helps provide safety, external and internal. We all have a love and belonging need. We'd like to think we are independent, autonomous, and don't need anybody, but that is a sign of perfectionism, or a symptom at least. And so we all have a need to belong to someone or something. And when Tim Walsh was doing the question and answer today, he was talking about Zoom being slightly alienating, that we don't have true human connection or contact on Zoom, and he's right. We have a serious need for eye contact, and I had made the point that you can't make eye contact on Zoom because if I'm looking at somebody else, they're trying to look me in the eye, but they're looking at my image over here, and so we can't make that connection. Human touch and eye contact is so important. Let me tell you, give you an example. Back in the early 1900s, there were foundling hospitals where women who were unable to care for their newborns would leave their babies at these orphanages, these foundling hospitals. And the doctors wanted these babies to be safe. And so, they wanted these babies to be blank slates for adoption. So they didn't want these babies to attach to the nurses, their caregivers in the orphanage, because they wanted them to attach to their new mommies once adopted. And so the nurses would wear complete PPE. They would wear hats, masks, gloves, gowns, aprons, and would have no physical contact with these babies. They met all of the babies' physical needs. They fed them, they burped them, they changed their diapers, they laid them in their cribs. So they met all of their basic physical needs, but they did not have skin-on-skin contact, and they did not make eye contact with the babies because they didn't want the babies to attach to any of the nurses. This was intended to protect the babies from bacteria and viruses, but also attachment issues. And what happened was the death rate was close to 100%. Because their need to belong, their need for human connection was not met. We have a deep need for human connection, and we find that through intimate partnerships, family, friendships, work, community, church, and AATH. And other memberships too, but AATH especially. What happens with in these relationships is they provide companionship and affection and intimacy and authentic communication and social support, common interests, shared goals, mutually beneficial exchanges, inclusion. So we have, I think, the most notable issue from this pandemic, aside from, a lot of people are dying and a lot of people have gotten sick. That is devastatingly sad. But the collateral damage of this has been our social isolation. And it is time that we get this need met however we can. And again, I've been asked this question often by audiences: how do we get back out there? How do we start to initiate conversations? How do we initiate relationships again? And it goes back to my advice before: take that first step. Just what's the first thing you could do to reconnect, to find those emotional needs, those social needs to be met. Yeah, we forget how to people. So back in chat, so I've asked about how does humor, laughter, playfulness engage and meet physiological needs, and how have they met safety needs? Well, now, and I've seen some answers already related to this, how do they meet our love and belonging needs? How does humor or playfulness or laughter help us meet our social needs? Build community, bonds us. It's a great connector. It's the shortest line between two people. Yep, breaks down boundaries. Connect, yep. Good. Yep. Oxytocin, yep. Good. Contagious, yep. Good. It acts as a social lubricant, especially if you have affiliative humor. Self-deprecating humor does too, and self-enhancing humor a bit, but really, if you have an affiliative humor style, that is absolutely a social lubricant to bring people, to draw people to you and help you connect to others. It makes you very attractive. It does. It enhances those connections to others that you have mentioned. It contributes to satisfying interactions. Like just a serious conversation is good, but if you have a serious conversation and then you can laugh, that is much more gratifying. It triggers positive feelings towards one another, fosters emotional connection. It releases that oxytocin, which is the bonding hormone when a woman gives birth. Her body is flooded with oxytocin. When you are having intercourse with a person and you have come to climax, it releases oxytocin. Laughter releases oxytocin. It engages those mirror neurons and it helps heal resentments, negative conflict, it patches tears in relationship. Yes, it helps us to go deeper emotionally. Yakov Smirnoff, should I call him Dr. Yakov Smirnoff? His doctoral dissertation, I thought it was a great hypothesis that the loss of laughter in a marriage is like a canary in a coal mine, that couples that don't laugh together might not stay together. And I think the Gottmans have something similar in their have found something similar in their work, that when we send out playful bids to our partner and the partner responds playfully, that enhances the quality of the relationship. Laughter and humor does, it helps heal trauma and painful situations as well. So there are so many social benefits. Now, if you remember on that hierarchy of needs, we have physiological needs and safety needs and love and belonging needs. And then there's esteem needs and transcendent needs. Let's talk about esteem needs. Where do you find your self-esteem? Where do you feel good about yourself? Maybe it's in an area where you're particularly competent, or where you garner respect. Or maybe it's an area where you've taken on a particular area of responsibility or leadership and you have found yourself really thriving. Maybe it's an area where you found independence or autonomy. After my husband died, I had to take on a lot of roles and tasks I didn't know how to do. And I found myself to be way more independent than I thought I could be. Maybe you find your self-esteem in self-improvement or ongoing personal growth or professional development or lifelong learning. Some of us we cannot stop learning. It's where we find ourselves. Hobbies, we thrive in our hobbies. Altruism, volunteering, actually, I just want to stop right there real quick. Altruism or volunteering, doing the good thing for another person or for a group of people, is one of the better treatments for clinical depression, along with medication and talk therapy, aerobic exercise. But we're also finding that volunteering or altruistic acts can be really beneficial therapeutically. And when you help others, it gets you outside of yourself. And you get outside of yourself, you kind of lose track of some of the BS you're telling yourself about who you are. So altruism is healthy. Encouraging patients with chronic pain to volunteer. Good. That's really great to read. Thank you, Mary. Internal locus of evaluation, I talked about the external locus of evaluation, but when you start comparing yourself to where you were, who are you now compared to where you were? I hope you can gain some positive self-esteem from that. Asking for help. I'm finding that if I am able to ask for help, I feel better about myself. It's an act of humility that I like about me. Transparency and authenticity. And again, humor, laughter, and play, the best compliment you can give me. You can tell me I'm smart. You can tell me I'm a good teacher. You can tell me I'm a good mother. Tell me I'm pretty. Those are all really nice compliments. But if you tell me I'm funny, I eat that up with a spoon, man. I find myself, oh, thanks, guys. Oh, doesn't mean as much when I have to ask for it. Anyway, your self-esteem might be in your play or in your laughter or your ability to bring laughter out of other people. And finally, before I get to the last slide, I just want to ask, what are you doing well? What isn't going well? There's something here you're just not quite happy with who you are right now. Can you re-access something on this list that you used to do, that you really loved, that brought out your best self? Can you go back to it? I was talking to my brother last night, and when he was a kid, all he wanted to do was play guitar. That's all he ever wanted to do was play the guitar. We would have chores. We lived on a dairy farm, and we would have chores, and he was never doing this. We all had to like pick up the slack because he was playing the stinking guitar. Well, now he's 55 years old, and guess what he does all the time? Whenever he's not working, he's got his guitar in his hands, because it's an extension of himself, and that is when he feels he's at his very best, is when he's playing the guitar. I resented it when we were kids, and now I admire it so much that he has that source of deep self-esteem. So finally, self-actualization is at the very pinnacle, and not everybody, according to Maslow, reaches this, but Tim Walsh talked about flow today, and I love that concept. Mihai Csikszentmihalyi talks about flow, and we learned a little bit about it earlier. But it's when we're thriving, when we are just kind of at the pinnacle of challenge and loss of sense of self, when we lose sense of time and physical need, and we're doing something that is challenging and enriching and nourishing to our spirit. Where do you find that? Some of us find it in our laughter, in our play, whatever our play is, whatever form that takes. For me, I throw pottery. That is how I play, and I lose all sense of like I don't feel hungry. I don't have to use the restroom. I don't get tired. I'm just creating something. So in your play, in your expression of your talents, maybe some of us lose ourselves in spiritual practice, in meditation, in solitude, in connecting with nature. Again, altruism, not only do we gain self-esteem in doing that, but we also lose our sense of self, like I mentioned before, where we become transcendent of self. We move beyond the self. Aesthetics. My daughter is so drawn to beauty, philosophy and beauty. That is, she's actually kind of majoring in that in college. She loses her sense of self when she's surrounded by art, sculpture, paintings, when she's surrounded by physical beauty of flowers in nature. Or maybe you lose yourself through other forms of self-expression. But I really challenge you to kind of look at the last two on the list of meaning and purpose, or finding your why. Responding to your vocational calling. When Scott was alive, my husband, he worked for Wonder Hostess, Twinkies, ho-hos, ding dongs, Wonder Bread. He is contributing single-handedly to the morbid obesity crisis in the United States. And he did not like his job. He actually hated his job. And you've met people like that they do not enjoy their job. Some of us love them, love our job, some of us don't. But his job was not his why. His job was a way of making an income to actually contribute to his why. So for Scott, his why, his reason for living, the one thing that gave his life meaning and purpose was rescuing horses from abuse and neglect. And teaching children, at-risk youth, children with disabilities, children that were coming out of difficult homes, teaching them how to ride horse. And so he would take a horse that he had rescued from abuse or neglect situation, and he would pair it with a child who was on the autism spectrum or who was coming out of an abusive situation or who was at risk, and he would pair them together. And it was amazing to hear sometimes a child who was nonverbal whisper into the ear of a horse, or he would lift a child out of a wheelchair and put it on the back of a horse and gently lead it around. And the gait of the horse actually creates neural connections in the brain that mimic the human gait. So Scott would use his job that he didn't love to support his why, his meaning, his purpose, the reason he woke up in the morning. So, yep, hippotherapy. We self-actualize when we are able to locate our meaning, our purpose, our why. And for so many people on this call right now, I suspect your why is bringing laughter, levity, joy, peace to other people. Tap into that again. If you haven't been able to during the quarantine, take that first step, that first next thing to move back into your why. My question to you is, where are you finding your flow? And can you do more of it? When we look at this hierarchy of needs, I want you to look at the physiological needs that we reviewed, the safety needs, the love and belonging needs, esteem needs, or self-actualization needs. Because my question to you is this: what is one thing, not one thing in every level, but just one thing that I mentioned that resonated with you? You think to yourself, yeah, I could do that a little bit more. I encourage you to go back to what you were doing well in the past that you kind of lost. Can you do one of those things again? You don't have to create a whole new plan. You can re-access what you were doing well in the past. I'm Dr. Melissa Mork. I love you folks so much. You are my tribe. Thank you for being a really welcoming and warm audience. Thank you.
Fantastic. Thanks so much, Melissa. I really enjoyed that. If anyone has any questions, you can start throwing them out. I know we've kind of had an ongoing dialogue here, which has been great. I want to thank you too, because even at the very beginning, when you said, what is that one thing you're going to do for, going forward, that gift to yourself? And suddenly I found myself going, there's something that I've always just taken for granted, but never been intentional about. And that's laughter. Finding each day that reason to laugh. It doesn't matter what's going on around you, but that I think will be the biggest gift that I will be able to give to myself and others going forward. So thank you so much for that. Question, and I think you can see some of these questions. You mentioned about self-esteem and used the word deep self-esteem. Is self-esteem measured by high or low, healthy or unhealthy, deep or shallow? Sorry, my native language is not English, so please help me how we can measure your self-esteem.
So there's complexity there because we have different terms like self-concept and self-esteem. And so self-esteem, we usually measure in high and low. And so low self-esteem is when you're not thinking much of yourself. You don't really like yourself. You would You might use some pretty harsh language in describing yourself internally. And high self-esteem is when you're feeling, it's not arrogance, it's not narcissism. High self-esteem is thinking, yeah, I'm not bad. I'm doing okay today. And so it is kind of measured on high to low as a spectrum. That's a great question.
Another question is from Brian. Who are your favorite comedians? There's a good
Who
one.
are my favorite comedians? Well, there's a bunch on the call right now, but so I have a hard time narrowing it down because I watch comedians in cars getting coffee. If I binge on something, it's usually that with Jerry Seinfeld. Yes, I do love Maria Bamford. She's a fellow Minnesotan. She sounds just like me and Tom. And I love, let's see here, because I've been doing a lot of open mics. Well, I was before COVID and starting to get back into it. So most of my favorite comics are like people that I'm doing open mics with. They're not well known, but they're in Minnesota. I tend to lean clean. I like clean comics. I don't like people that go pretty blue. But yeah, Seinfeld is probably one of my favorites. David Letterman is one of my favorites. Maria Bamford is one of my favorites. Tig Notaro is one of my favorites.
Awesome. Yeah, that's a hard one. When someone asks you who's your, it's like just off the top of your head. That's kind of hard because
ask me who my favorite child is. I could answer that more easily.
Well, that's an easy answer. Depends which one you're talking to. Yeah, I love the idea too of your internal threats. And the concept there of so often they're there, but we don't even recognize them. We don't, I love that term because I've never thought of those as, internal threats.
Yeah.
How do you deal with that, or how do you kind of come over some of that, overcome some of that?
That's a great question, because sometimes the harm that is being caused because of those internal threats, that we're not keeping them in check, we're not monitoring them, the harm that can be caused could be so deep that it might require professional help. I see a therapist. I think every person should have a therapist kind of available in times of crisis or when things are getting particularly difficult. And so I think when the harm is so great that you are finding it, okay, I've got 4 Ds for you to think about real quick. If you're in distress, if you are so depressed, anxious, having panic attacks, PTSD or other conditions, you're having symptoms that are deviant, not like you're not yourself. You're not acting the way you usually or used to act. The behaviors are deviant. You're in such, your reactions to other people are extreme, or to situations is so extreme, it's deviant in how you usually act. And if it's distressing, the internal threats are so great and it's causing you really upset, or it's distressing to other people that you're acting out, or you're lashing out and it's causing distress to other people. Or if it's dysfunctional, your behaviors are getting in the way of you doing things that you normally should do, like working or parenting or being in a relationship. So it's causing dysfunction. Or if it's causing external danger, you're hurting other people or you're hurting yourself. There are those 4 Ds of deviant, distressing, dysfunctional, or dangerous. Then it's time to see a professional, a mental health professional, to really kind of work through some of those deeper issues of internal threat.
Yeah, I think oftentimes we forget that internal voice, we think it's a whisper, but it's the loudest voice we hear.
It's a megaphone.
It's huge that way. And yet we think, oh, it's just that little internal chit chat that's going on. And it's not. It's one of the most impactful on all of us. A question from Ola. Can you share some things that didn't work for you? Any mistakes we can try to avoid?
You got another hour, Ola? Oh man, I do not have this mastered at all. Like, as far as self-care goes, there's a lot of things on these lists that I'm not doing. I'm not hydrating. I'm not exercising right now. I'm saying some pretty cruel things to myself on a daily basis, but that's why I see a therapist. So So yeah, there are some things, and I think it comes down to accountability and priority. So I need to, I have to set what is a priority for me and what can I just let go. And then, and I think that's the biggest failure, is not letting go of things and demanding that I be better, more perfect or perfect. And so I think letting go of the things that aren't a priority for me and being okay with that is my best lesson.
Yeah, I think sometimes that perfectionism, we're so hard on ourselves, and giving yourself some grace is huge, you know,
Amen.
and because none of us are perfect,
Yes.
you know, and so
Agreed.
let me see if there's any other questions. I don't have any open questions. If there's anything in the chat, I think we're good there. Well, Melissa, I just want to thank you. I don't know if you, oh, I got one more just popped up from Brian Harmon. Within affirmative humor, there's the one-sided style with entertainers and audiences, and two or more sided, more organic and spontaneous style that happens in the moment. The witty banter stuff, both can be good for trust building, but what do you think about the jokesters that are too hesitant to share jokes because they try to stay work appropriate?
Yeah, no, I think, boy, I don't know. Yes, affiliative humor, it is so spontaneous, and if we really want to be funny, then we have to remove some of the filters, but then we remove too many filters, and that's where the risk lies. I think, I don't really know how to answer that question. I would love to have that conversation with Brian directly to hear what he thinks about that. But yeah, I think taking a risk and stepping into it is it's a courageous conversation to start, for sure.
I think we have time for one more question here. After all that, this is from Ron Burke. After all that we learned and experienced this past year, should we determine our own new normal, not what we did pre-COVID?
Hey, Bucko. Yes, I think so. I think so. I think we have to. I think we have to dispense with the things that weren't working before. And this has been kind of a wake-up call, a 13+ month long wake-up call of some of that stuff didn't work. And it's time to take what was beautiful from the past and bring it forward, and then discover some of the new things that we want to implement. So yeah, I think we need to abandon some of those things. We don't need to go back. It's like astronauts coming back in re-entry, right? They're coming back and their muscles are flabby and their hearts are smaller and they're disoriented to time and space and gravity, and there's some cognitive issues, but they're coming into a new time. They're not re-entering into the time they left. They're re-entering into a new time, and that's what we are doing too. Is that, yeah, our muscles might be flabby and our hearts are smaller and our faces are puffy, but we're entering into a new time.
Yeah, I think that's a great point. I mean, we're living in the present. It's not the past, and the world 13 months ago is very different today. And so it's living in the current and doing what we need to do. So, Melissa, I think we're at that time. I'm going to say thank you so much. Loved this session. I hope everyone else did. I just, as a reminder to everyone, I think we have like a 10-minute break here. And at 10 minutes past the hour, then we'll be getting together with Jennifer Keith for the magical moment of play. This is something you're not going to want to miss. So we'll see you all back in 10 minutes.
Bye, everybody.